All right. Good evening, one and all, and welcome to ISOM's free live lecture on sports injury prevention and sports taping in athletes. I am joined by Dr. Kryson Digama, a sports physio and an experienced clinician working in India. So he's an experienced person who has worked with the West Indies cricket team, Pro Kabaddi League. So he has seen a lot of athletes. So he's a best bet. So without further ado, guys, we will start with the free lecture. And just letting you know, yes, there will be a post lecture quiz. Dr. Kryson has sent beautiful questions. And if somebody passes that with a score of 7 out of 10 in their first attempt, then we give the certificates to that person because please understand you have to attend the lecture till the end because this is not just online, but this will also happen in person, hands on, because we understand that taping and such things cannot be learned just online. So, Dr. Kryson will be taking this course in person, hands on, very soon in November in the city of Mumbai as well. So over to you, Dr. Kryson. Thank you so much for doing this. Thank you for your time. Over to you, sir.
Thank you, Dr. Parijat, for inviting me. Am I audible and can you all see me well?
Yes, we can see you very well. Thank you.
All right. So, as we begin, I'm really excited to give you all this talk on injury prevention and taping. At the onset of the talk, I just want to tell you all that all the content in this PowerPoint presentation is uh, is the legal copyright material of iZoomed. So, kindly do not share it, or you all will be liable for action. So, yes, as you all know that I have worked with the West Indies legends, the Road Safety World Series, Brian Lara. I've worked with the Jaipur Pink Panthers and many other leagues. And in my experience, I've understood one thing that, being a sports physio or even a musculoskeletal physiotherapist, it's all about the preparation. If you are well prepared, you're going to do well. What you do on the field depends on 70% preparation and 30% quick thinking and taking the right actions. With that in view, let's go ahead. So, we all know that a sports team consists not only of a physiotherapist, but of course, the athletes, the managers, the coaches, strength and conditioning coach, or an SNC coach is very important because you and the SNC coach together will work together towards planning and preparation beforehand to reduce the injury risk. Sports scientist, if present, excellent. A sports massage therapist, a nutritionist, psychologist, if the team has the budget, and of course, media team. This is approximately all included in the team. Now, why is this topic so important? Like you all saw in the video, the advertisement video, we know that the risk of injury is really high in all athletes. If you all are sports physiotherapists, you all must have seen almost every athlete has experienced some kind of pain or injury in his or her life. It goes from 46% to 72.3%. That is the increased risk of injury in sports athletes in India. And if you all watch the IPL auctions, we all know how much was Rishabh Pant bought for. Something I think, since the question answers are off, uh, if anyone knows, it's around 27 crore, if I'm not mistaken. And in Kabaddi 2, the highest bids were around 2 crore. Now imagine you are a physiotherapist, the team physiotherapist, the head physiotherapist for this team, or even a smaller team in general, and they have high stakes. They have bought these players, and they expect this player to perform really well and win the cup, and gain a lot of sponsors, etc., help them to get their money back. And imagine on the first match this player gets injured and he's out for the season. Who will they look at? You and me. So that is why this is a very important topic. However, not only it's not only about the money and the stakes, but just imagine the athlete's life. A ACL injury or a spinal stress fracture can take them out for the season, because the recovery is around 6 months for ACL plus minus, and for spinal fracture it can be 8 months to 10 months. And the BCCI, that is the cricket board, has very strict rules for return to sports for bowlers. if you know, it's around 8 to 12 weeks post absence or post an injury. So these things are very important. That's why we are taking this topic, a short topic, 1 hour, in which I'm going to include really good, a comprehensive approach to injury prevention. Whatever I can do with the latest evidence. So, what is our role of a as sports physiotherapist? First is injury screening, identifying injury risks, planning a program for correcting these deficits, rehabilitating from previous injuries. So you must note that the highest uh, precursor for injuries is a previous or past injury. For example, if an athlete has an lateral ankle sprain, there's a really high chance for him to have another lateral ankle sprain in this season or in this the coming matches, unless you step in and do something about it. Pre-game preparation for injury. This is what you do last minute, the 1 hour before the game. That includes taping and warm up, etc. So please note, this is a very important slide. This gives you the 4 steps towards injury prevention. Now, why have I included performance enhancement? Because if you are able to rehabilitate the injury in players, you will see their performance improve. So this is also included. You cannot divide it and say they are two different. The first and foremost step is first see where you are. When are you meeting with the athlete? Is this an athlete walking into your clinic or your center or your hospital and just saying, I want to, I'm a season is coming up and I want to just check for any injuries? How can I reduce my injury risk? Or are you with a team? So based on that, you have to get documentation right. You have to get a good book, a Google Drive, a spreadsheet, and start including all this history, because documentation is everything and can save you. Because if tomorrow a problem happens and the coaches come to you, you can say, see, these are my documentations. I have clearly included that this athlete was at risk for an injury. Okay, so history and planning. You'll all know about the demographics. You need to have a good idea about their past history. You need to get an idea about their surgical history, medical history. Very important to know the BMI and the entire blood screening. So this is done usually with hospitals and diagnostic centers. Usually the sports team has an affiliation with them. So all the athletes usually can go and get that done. So if you have an individual athlete, you have to get them to do a good blood work. If any past injuries, you need to do radiological diagnostics like an X-ray, an MRI. These are just things that you got to keep in mind. Very important is the workload. What is their training history? How much do they train? We'll speak about workload a little more if you don't know about this. Then once you get all of this in place, you make it into a nice document, categorized. You can make folders of each players with this history, their demographics. You can have a nice assessment format or a history format and give them to fill it to save your time, especially if you have 20, 30 athletes with you. The second is physical screening. This is where you come in. Physical screening has to be done at the start of the preseason. So that includes a full body musculoskeletal screening. Not just, okay, this player has a shoulder injury. You're not just going to focus on the shoulder, but from the head to the toe, you're going to do a comprehensive general body screening. And this can be even done for an athlete who walks into your clinic, or even a recreational player or a weekend warrior. And this can be, if you learn this well, you can also sell this as a musculoskeletal screening. The third is the functional movement screen that we'll talk about, Y balance test, and various other physical screening tests. Once you do this, you document it, you go to your physical testing that is usually done by the strength and conditioning therapist. That includes tests for speed, strength, agility, speed, endurance, core, power, the one RM testing, neuromuscular and proprioceptive testing. And finally, last but not the least, is the sports readiness. That is the athlete ready psychologically to get back to the game? There's a big, what do you say, a line of events that an athlete has to go through before they get back to sports. not just doing basic rehab and then getting back to sports. Return to sports is another topic in itself, where you have return to participation, return to sports, and then getting back to sports. So having their equipment checked, doing taping if necessary, and sports drills, return to play, and also having a good questionnaire to check their psychological readiness. Okay, a lot of theory. Now we are getting more into practical. So, like I said, injury prevention starts pre-season. Off-season is when the athletes are enjoying. And to tell you the truth, when I was with the teams, most of the athletes, we think, during their off-season, they're going to be enjoying. They're going to be training hard. They're going to be playing. That's not always the case. Many of the times they are busy with their work. They're just enjoying their life. So imagine that when they come to you, they're going to come with all sorts of, low endurance, buildup of their fat percentage, etc., etc., etc. So you got to catch them at preseason. This is usually when the preseason camp is planned by the team. So when I was with the team, we were taken to a city in North India to have a preseason camp to train them, to screen them, and then is the in season. That is when the competition starts, when the tournaments start, and post season is once the tournament ends. What are you going to do? So we start injury prevention planning at preseason. At the start of this lecture, I also want to say that rest and recovery is very important. Sometimes these are small things that we just ignore as physiotherapists and trainers. But if an athlete doesn't have sufficient rest and recovery, they are going to have an injury for sure. Even if their musculoskeletal screening is perfect, they have a good functional movement screen score, their blood reports, X-ray, no past injuries. You have to understand that junior athletes are trying to make a mark for themselves. They're giving their best. They want to push themselves in front of the coaches, in front of the selectors, because that is their livelihood. They're going to earn from that. They're going to become famous. So they push themselves sometimes beyond the 100% mark. And here it is our role to say that, okay, boss, you have to take time out. You have to go for a massage. So passive recovery, stretching, go for active recovery like swimming, or we used to have weekend games, a volleyball tournament, where there is, light, fun, active recovery for mental relaxation as well. But the most important recovery tool that science and evidence says is a good sleep cycle. This is very important. 8 to 10 hours of sleep for athletes, especially if they are having a really high training cycle every day. So that is the most important recovery tool. Everything else, nowadays the market has many tools like the massage guns, cryo, heat baths, jacuzzis, etc., etc., etc. Even the pneumatic compression. The best tool is rest, that is sleep. So we go through a musculoskeletal screening. Okay, this is something that I use and I find it really effective. It can be done between 30 minutes to 40 minutes. We're just going to brush through it. The first is when the athlete comes in. This can include their demographics. So the name, age, gender, the sport, the position in the sport is also important, and most importantly, their consent. Uh, Past injuries, medical, surgical history, any orthotics or prosthetics they use. That will tell you a lot about what are their injuries. Now you have to understand another thing, dear physios, is that when an athlete comes to you who is part of a team, do you think they are going to reveal their injuries to you at the preseason? Mostly the answer is no, unless they are really a high profile athlete who's in demand. Because if they say they have many injuries and you tell the coach about the injuries, uh, they might not be selected, or their deal may be broken. So they will try to hide it. So this is something that you keep in mind when you're screening for injuries, that if you're going to go very light on them with the test and the history, you'll just find they're completely okay. And then 2 weeks down the line, they are limping while running, and then the coach says, what kind of screening you've done? So this is important to know. So you need to be very thorough with all of this. Okay, what you need: the goniometer, a marker, measuring tape, a towel roll, and a pressure biofeedback if you're going to check core in that way. But I've not included that. First, you start with a general observation. I find it useful to mark or to have all the details in front of me, like the screen. I hope everyone can listen, hear me well, and see the screen at this moment.
Yes, we can see that. We can see that.
Amazing. When you have this in front of you, you can quickly tick mark these things. Because if you have a blank page and you're going to write observation, head is forward head, you're going to take 1 minute. Imagine you have 20 athletes and just 2 or 3 days to do this. Because sometimes these athletes are not all situated in your hometown. They're going to be flown in from different parts of uh, India, or sometimes even international athletes. And sometimes they come to you for just 1 or 2 days just to do this preseason testing or all these tests. So the team has to pay for their hotels, for their travel, everything. So you can't take your own sweet time. That's why it has to be crisp and quick. So when you have it all printed out, you can just tick mark quickly. Okay, the pelvis was neutral. The thoracic spine was kyphotic. The right knee had a valgus observation. The foot has a low arch or a flat foot, etc., etc. Once you go through this, the first I've included is shoulder ranges. So all these tests, you can't do every test under the book. You do tests that have a high evidence, reliability, and validity for injury risk. So these are some of the tests that can catch an injury easily. Getting an internal and external rotation range, the GERD, glenohumeral internal rotation deficit, and glenohumeral gain. So these are very important to know whether overhead athletes, throwers, swimmers, uh, their ranges need to be close to normal. Hawkins and Kennedy's empty can resisted external rotation. I'm sure you're all well aware of these tests, and we will be covering them in detail in the 2 days hands-on workshop. So in case anything is going over your mind, please register for that. Kibler's test for scapular dyskinesia. In the spine, we see the quadrant test, making them move in all the 4 quadrants. Single leg lumbar extension, combined elevation for thoracic symptoms, lumbar flexion extension. Like you all can see, these are not very fancy tests, but the basics. And sometimes we need to check the basics to go for to see the advance later. We sometimes focus on all these fancy tests, but the basics are not good. Core endurance, a slumps test, a limb length symmetry. And in these tests, it's better to keep another column with notes. For example, if the athlete is doing a plank, you notice his left hip or pelvis is dropping a bit. He's shivering a little. You ask him where he's feeling the pressure, more on his right shoulder. So you can just mark all these things during the test, and which will further on give you a more comprehensive idea when all the data comes together. Limb length symmetry, very important. Lower limb, Trendelenburg's quadrant test, the range test like the iliopsoas test can be done in the Thomas position. Hamstring test, so you need a goniometer. Very quickly you can do these tests. The dorsiflexion lunge test for the ankle dorsiflexion. If it's less than 10 centimeters, there's a high risk of having an ankle injury. The piriformis test, hip internal and external rotation. If the hip ranges are restricted, it can lead to a slow lumbar spine problem. In case any of y'all have attended the ISOM, the lumbar pelvic SI joint workshop, you all will really know about all these things. Posterior impingement test for the ankle. And then, so we've completed observation in the MSK, musculoskeletal screening, shoulder tests, spine tests, lower limb tests, and then we go for palpation. This is a quick palpation, the supraspinatus tendon. In case you all are not good with your basics of palpation, surface anatomy, please read up on this, because only then you can really quickly find these points. Rotator cuff tests, rotator cuff palpation, medial tibial border. What is that for? If you all know, for shin splints or medial tibial stress syndrome. Lumbar facet joints, very important to see any stress fractures or stress reactions in the lumbar spine that must have been overlooked. Erector spinae, how is it? Is it in spasm? Is it painful? The sacroiliac joints and the Achilles tendons. Now, another important point I want to tell you, you are not going to check an athlete as you're going to check a 70-year-old woman coming into your clinic. The amount of pressure that you palpate the supraspinatus tendon for a 70-year-old lady, even a light touch may cause elicit a pain response. But for an athlete, you have to be a little more firmer. That could be all the tests, a Hawkins and Kennedy test. If you're stabilizing the elbow and going into internal rotation, and this is a baller who's really going to go into internal rotation, you can't just go 20 degrees, 30 degrees. You have to go all the way to feel for the symptoms. So this is a point to note, that you got to do your test with more firmness and more pressure. Now, based on this musculoskeletal screening, these are the findings that I've put on the left side, if you all can see. And what is the action to be taken? This is very systematic and crisp. So increase kyphosis and right flat foot. So thoracic mobility and stretching exercises. Reduce left internal rotation, shoulder manual therapy and stretches. These are not the best, or you can say, I've just put this as an idea. So don't follow this as a plan. Okay. Left external Hawkins Kennedy test positive. ER is external rotation resistance test, and the MTCAN test test positive and palpation positive. So this is telling me that the left shoulder, there are many tests positive. So I am going to take this athlete aside when I get time and check their entire shoulder. Right, Trendelenburg's facet joint test gives me something to think about the left lumbopelvic hip complex. And that goes on. The right posterior impingement test, you assess the foot further. So some things like reduced ranges, you can give mobility and stretching exercises. But when many of the painful tests are positive, you need further assessment. And this is a plan that I would share with them. So if I can make this into a printout format and give the athletes and put the ball in their court, that you have to do this yourself until you come back for the preseason testing or whatever it is in your free time. For the shoulders, maybe face pulls, shoulder abductions. For the back, bridges, loop resistant band, bridges, clams. All right. Next, we go to functional movement screen. Functional movement screen is really good. It has a high reliability and it's very simple. Okay, anyone can learn it. You can use this as an assessment tool. You just need to know these 7 tests: a deep squat, a huddle step, inline lunge, shoulder mobility, active straight leg raise test, a trunk stability push-up, and like you can see G, that is the rotator stability. I'm not going to go deep into this, but when you do these tests, you come to know various aspects of the stability of an athlete. For example, if you do a deep squat and he's not able to keep the dowel over his head straight, you can understand there is some lack of thoracic mobility. Or if there is, if they can't do an inline lunge, you can understand there is some rotatory instability there. So how do you score the FMS? Very simple. There are just 4 scorings. 3 is for the movement completed without compensation. That is 3 out of 3 full. 2 out of 3 is what I would get, doing the movement well, but maybe some compensation used. So for example, when I did the deep squat, I couldn't keep my hands straight up. That showed that there was some lack of thoracic mobility. And when they used the heel raises, I could take it up. So that it was a 2 for me, just an example. And 1 is unable to complete the movement at all. If there is pain in any of these tests, we give a 0. So a score of 14 or less in the functional movement screen indicates a high risk of injury. Okay. So this is just an example of a score. It's 13. 7 threes are 21. So anything above 14 is needed. If it's closer to 21, all the more better. Strength testing is very good. Is the gold standard, I would say, to check not only the strength but also get an idea of agonist antagonist ratios like quadriceps hamstring ratio or external rotator of the shoulder internal rotator strength ratios, concentric eccentric ratios, and these have a lot of value in finding out the injury risk. Now we just focus on MMT, that is manual muscle testing, but the first line, if you can see, data shows that muscles that have lost more than 70% of strength can still show a 5-on-5 on MMT. So we cannot depend on MMT. Another option is having a handheld dynamometer. I have one which I use in my center to check athletes. But if you have access to the isokinetic dynamometer that is in this photo over here, that is present in sports centers, it is one of the best gold standard protocols. I've just included a video of stability testing that. So if you all can see this, what can you all observe in this right now in his knee over here? Can we get answers, Dr. Parijat?
Guys, if you can mention your answers in the chat box, I can convey that because I guess I have some technical glitch over here with the chat. So you're welcome to shoot your answers in the chat box. What can you observe on the second or on the right knee of this gentleman who is hopping on his right leg? Any compensations or issues that you find? You can mention in the chat box. Yes, I'm getting some messages. Internal rotation, valgum, rotatory movement.
Very good. Second, the third jump and the fourth jump were better. So you all are absolutely right. This is a triple crossover hop test that is used to clear an athlete with any lower limb injuries return to sports. So this was an athlete who was a footballer and he had a ACLR, anterior cruciate ligament surgery, and this was, I think, maybe 5 or 6 months post his rehab. And you can see that there was an internal rotation of the tibia and a valgus of the entire knee. So this could cause a, if he was jumping and not landing well and there was more valgus of the knee, this is actually the mechanism of injury for ACL. I'm sure you all know that. So he has to still work on his technique. And how does this test work? We make the athlete have 3 hops. So from the start line, as much as they can, and each hop has to be firm. They should not lose balance. And the third hop, so 1, 2, and 3, they're supposed to hold it for 1 second. And you measure that distance, and then you check the affected side. Both the distances should be equal or close. If there's a distance of more than 1 feet, that means they have a risk of injury on any of the joints of the lower limb. So the ankle, the knee, or the hip, or maybe even up the kinetic chain. So this is a good test for y'all to keep in mind if an athlete comes to you with an ankle sprain and they say, am I ready to play sports? So you can just ask them to do these tests. Of course, pain, the absence of pain is the most important. The ability to sprint, and maybe this third test, a very basic protocol for injury, for saying that you're ready to return to sports. But however, every injury has a return to sports criteria. There are articles for it. There are consensus articles for it. So you all should search for these articles to get more knowledge. What I am showing right now in this limited time is just a comprehensive or a quick way to at least get your minds ready for injury prevention. Now, training workload. Okay, I'm going to make it very simple. What is workload? Workload is the amount of work done during a specific time. Okay, so for example, a bowler, say a fast bowler, he bowls around say 50 overs every week. Okay, 50 overs every week in the practice, whatever practice. So that is his workload for the week. Okay, now what is this complex graph? I'm going to make it very simple. This speaks about how we can get the athlete to top performance here. Okay, top performance is this star over here. If you are training the athlete very less, so this is a very simple example, making him do only 20 to 30 overs in a month. But when the tournament comes, he has to do around say 50 to 60 overs or maybe 70 overs, or even a marathon runner. If he has to run say 50 kilometers, but you're making him run only 30 kilometers, you are under training him. Okay, undertraining also has an increased risk of injury when the time comes for the tournament. Overtraining is basically making the athlete who does 50 overs per week, making him bowl 70 overs per week. And that too is excessive load that can increase the injury risk. And this is the most common thing. After past injury, this is the second predictor of injury risk. This can only be noted if you've documented what is their workload. So that's why demographics and history is important. Optimal load is when the training is somewhere close to the load that they need. So what is this AC ratio? Okay. AC ratio is acute to chronic ratio. So how it is calculated is very simple. Okay. You just take the load of 1 week, okay, on the top, and you divide it by the what do you say the average of the entire month. So for example, if your preseason is of 4 months, okay, it will be more obviously, and he is bowling say around 50 60 overs, so the average is say 50 overs. Okay, and this month he bowls 70 overs. So I'm opening my calculator. 70 divided by 50 is giving me a 1.4. Okay, so 70 overs this week over the average, that is average of 4 weeks is 50. So 1.4, if you see here, is just near the excessive load, or basically going to overreaching. So there's a high injury risk. Now the same athlete, if you make him bowl 30 overs divided by 50, which is the average, if I divide, I'm getting 0.6. Okay, it's opposite. So that is going under training. So that is how you measure the optimal load. So around 50 would be the optimal load. This is a very simple example. It's much more complex in seeing the overall load, not only bowling, but gym, etc., etc., etc. So this is something that you can use with your runners, with your badminton players, how many hours they are putting in, or whatever sport you have, you can use this formula. The load should change as the season. Off season, we are doing more of physical training, strengthening, less of skills, that is technical, and there's also rest to recover from any injuries. Pre-season, that is 2 months or 1 month before the actual tournament, they're doing a lot of technical and physical training. That is around 50 to 40, 60, 40%. And finally, in season, you reduce the workload. Pre-season, the workload is high. In season, you reduce the workload and you work more on their skills. And a good warm-up is really important, my friends. You all know this. So I want to introduce you all, if you don't know already, the FIFA 11 plus warm-up routine. The research says that it has reduced injuries in teams that have been playing football over time. When they included this warm-up, the injuries included reduced by 30 to 39%. Hamstring injuries, neck injuries, knee injuries. There are many good evidence articles on this. So it is very simple. And believe me, if you learn this really well, you can go to a team, a local football club, a local cricket club, and say, speak to the manager and say, I'm ready to teach your students the warm up that is approved by FIFA that will reduce their injury risk by 30%. That might save your star player. They will be more than happy to sign you up as their physio, or at least take you to teach them this warm up routine. And it's very simple. So it includes three things: the running exercise, that is 8 minutes. You do straight running up and down. Uh, you all can find this online. I know the picture is small, but I wanted to put it in one slide. So running with the hip outs, hip ins, hip circles, circle running with a partner, running with shoulder impact, quick forwards, backwards. That is the running exercise. Second is strength and plyometrics. That includes planks, side planks, Nordic hams, single leg stance, squats, and their variations, and jumping movements for plyometrics. And finally, we have long distance running across the pitch. So if you see, it takes 8 plus 10 plus 2. How much is that? 20? 20 minutes to do, and twice a week really reduces the risk of injury. You can do this before a match also. Equipment and gear. Sometimes, most elite athletes know really well about this, but newer athletes, weekend warriors, may not understand this and just buy anything that comes on the market. So it is important for you as a physio to have at least some knowledge of this, because if they come to you and they ask and you're like, what is this? I have no clue about it. Your status or your respect will reduce. So in racket athletes or even the rubber bat, so it's important to know the kind of grips that are available and how it impacts their grip strength. They should be comfortable with it. It should not be an old grip. It should be a new grip that is used. In the rackets, the wire, the tension wire, the more the tension on the wire of a tennis or a badminton racket, the difference, there is difference in the power of the hit. That includes increasing the pressure on the wrist and elbow that can cause carpal tunnel or tennis elbow or various things. So it's important to know uh, tension, sizing of the pads, the helmets, the gloves. If it's loose, it can cause an injury. Shoes, there are different type of turfs coming up nowadays, and pickleball, and there are so many athletes. You can't wear any shoe and play. That increases the risk of injury. Just yesterday I went for a pickleball match with my friends, and I asked two of my friends who've never played before to come, and they came in sandals. Halfway during the game, one guy was like, my ankle is paining really bad. So you can see how it, you might think this is very simple and general knowledge, but you have to always treat everyone as if they don't know anything and teach them the basics. So there is artificial grass outsoles, firm ground outsoles, soft ground outsoles. There are research articles on this also that I've mentioned here, which you can check out. Braces, many athletes want a certain kind of brace. There are different quality braces in the market, simple ones, expensive ones. So you need to have a good idea of all the braces that are needed for either prophylactic, injury prevention, or rehabilitative purposes. Many athletes, even though they don't have an injury in kabaddi, they wanted knee braces because they felt more confident. And finally, if your team does not have a what do you say, a nutritionist, you need to have an idea about diet and nutrition, because if this is missing and all the boxes are ticked, they can have an injury if they are dehydrated. What if you go see, it's so hot right now in India for all attending. What if they go for a match at 12 o'clock? They all, well done on their what do you say, musculoskeletal screening and history, etc. They're really strong, they're at top form, but they have not drank water, they've forgotten to eat well. There's a high risk of heat stroke. You need to include all the macronutrients, the micronutrients, and need to have a good test also of their uh, what do you say, body composition test to know their muscle mass percentage, their fat percentage, their bone weight, and that should be close to normal. So y'all can to find out more about this and include it. in your screening if there's not a nutritionist, and that will increase your value in the team. And finally, athlete psychology. So you know, even Virat Kohli or Brian Lara or any player on field before the match, 5 minutes, 10 minutes before the match, they have their own routine which they do to prevent getting nervous and to get their top performance. And they are the best, but ultimately, when your mind is in top form, you will win the match. So that is very important. So if you see athletes go through tremendous ups and downs, they are selected. So just an example of a cricketer. He's selected in Jan 2023 in Mumbai Cricket Association. I'm from Mumbai, so I've put MCA over there, part of the A team. But in June 2023, he did not qualify due to poor performance. So he has got a really negative setback. That was his dream to become a cricketer to play for India. Then in 2024, he's selected the next year and he wins the Ranji Trophy championship, which is great. And he's caught off guard in February 2025 and he has a grade 3 ACL injury and he needs surgery. And now in October, what is today's date? October 18th, he's come to you. He said, okay, I've done a surgery. It's been how many Feb, March, April, May, June, July, August, September, 7 months. Am I ready to get back to sports? Can you check me? I'm going to apply for the MCA again. And you have to understand what all he or she has gone through. Negative life event, stress has a strong association with injury rates. Okay. And few scales that you can include to save your time is the Tampa scale of kinesiophobia. That kinesiophobia is the fear of movement. Very important to include. Or if it's a knee, there is anterior cruciate ligament, return to sports after injury. Now, not all return to sports scales check their psychological component. So it's very important to these scales check the psychological component. And this is one of my favorite short scale, injury psychological readiness to return to sports, IPRRS scale. It just has 6 questions and you have to score from 0 to 100, 0 being no confidence at all, 50 is moderate, 100 is complete confidence. So you need to suppose they say 50, 100, whatever they mark in these 6 questions, you calculate the sum of all scores, divide by 10. So a score of above 50 is that they are psychologically ready to return to sports. 60 is the max score, 0 is of course bad. So you need to be 50 and above for them to return to sports. This is an article before. These are recent evidences that check. So whatever I've put in today's talk is not random stuff, but based on careful research and evidence. And now for everyone's favorite topic, taping. Okay, taping is taking a lot of importance nowadays because of social media. And do you know how taping came in the first place? I've done a lot of reading on taping. Some when the TV started and they initially started broadcasting the Olympics, a player for the first time wore kinesio tape or some colored tape on his body. And seeing that was the first time it was telecasted throughout the world. So imagine so many athletes seeing that they got what do you say, wooed, or they went, oh, what is this? This is something new. And then taping shot up. So you need to know the roots of taping also, not just be influenced by things coming on social media and use it, which actually happened and boosted taping. So there are 4 kind of tapes. Rigid tape is a hard tape. I've got some of the meaning of rigid is very simple. It doesn't stretch. And there is zinc oxide tape or athletic tape. They are just some different kinds of rigid tapes, but it's the same. The idea is it doesn't stretch. Elastic tape, there are 3 different elastic tapes. The first is kinesio tapes. So this is one example of kinesio tape. Just going to tear a piece here. That stretches. Okay, it stretches well. Second is elastic adhesive bandage. So this is an elastic adhesive bandage course, you all can't feel it, but you all can see it stretches a bit. Okay, it's somewhat middle of, it's more a cloth kind of bandage. Then there is dynamic tape that is new in the market, that has a mechanical recoil. That is, it not only stretches, but it can pull back. It's stronger than kinesio tape. There's also something called rock tape, that is a new kinesio tape that helps to pull back. It works a little like rigid tape. It is used a lot in conditions like carpal tunnel syndrome. Like you just put the piece over here with a stretch, and it pulls back the structures to improve the space, lymphatic drainage, etc., etc. So you can Google on that. Cohesive tape is a self-adhering tape that does not have any adhesive. It's one of my favorite tapes, and I use this because so for example, I've had a wrist pain. Yeah, I had a wrist pain with all the manual therapy that I was doing. So whenever I get that, find this. I'm going to do a demonstration of something, a quick fix for me. I keep it on my, yeah, I put it on my wrist like this, and I just, this is a small piece, this a bigger one. So most athletes, the West Indies legends, the cricketers that I face, they love this cohesive tape. They just take it and do it themselves because it's very skin friendly. It's also economically a bit less compared to dynamic tape. So hold it here. So one of the ways you can do it, put my hand from the camera, is just wrap it. And like you'll see, it just sticks on itself. This is giving me a good compression, and it helps me during manual therapy or excess because I'm overload of work sometimes and also working out altogether puts a pressure on my wrist. Okay. So where were we? Yeah. Cohesive tape. There are different kinds of it. There are more slides that will speak more about it. And the fourth type is protective tape. One is an underwrap that we place under the skin when we are going to use rigid tape to protect the skin. A second is a cover roll. Those are, I don't have those, but suppose you have done taping, say an elbow taping to protect a tennis elbow patient. You put this tape over the tape to prevent it from coming out, because athletes are going to be in really harsh contact sports at times, and a movement, a hit, a scrape can remove the tape. So over tape helps it. And turf tape is something very simple, a tape that you put on your elbows, knees, or ankles to prevent an abrasion when you fall, to protect the skin. So these are the overview of taping. This is a very important slide, dear physios, so please concentrate on this. Scientific consensus on sports taping. And this article is also very good, which I've mentioned down, a 2020 article, taping for conditions of musculoskeletal system and evidence map. What they have done, they have taken all the major conditions, be it supraspinous tendinosis, Achilles tendinopathy, patellofemoral pain syndrome, hamstring, etc., back, and they have found out all the articles for each condition, and they have given 4 tapes, that is rigid, elastic tape, I think Mulligan tape, and dynamic tape. So all the 4 condition, what is the evidence? They have just given, is it strong? Is it medium evidence? Low evidence? Or is it rejected? So it's a really good article to see, are we using tape just because it is fancy and we want to show the athletes that we know stuff, or it has some medical scientific evidence. So what are the evidences or the physiology that tapes work on? The first is enhanced proprioception. When you put a tape anywhere in your body with a stretch or with a compression, they are going to activate the mechanoreceptors, and that is going to improve a proprioception. The athlete, what is proprioception? A sense of movement, a better sense of movement of the joint. So the athlete will be able to move better with that. The second is pain modulation. When a tape is put, so there's another research that has come out on 20th of August, August 2025. That is a meta-analysis and a summary. And it says that wherever a tape is put, it is going to activate the nerve endings on the skin, and that is going to give a pain modulation. So if you just put a tape anywhere, it is going to have some pain modulation, so which is a fact. So how you use these principles and your techniques will help to get a better outcome. Third is psychological confidence. So when I was with the kabaddi teams, there were athletes, they just wanted tape to be put for every match, no matter, they didn't need it. And they wanted it their technique, which is not an evidence-based technique. But when they did it, they felt really confident. So what should I do? Should I give them a lecture on this is wrong? At that moment, the right thing to do was just do the technique that they wanted rather than arguing with them and making a scene, which would affect me. So psychological confidence. Sometimes even this 2025 article says that when the athlete believes that this is going to help them, it will help them to some extent. That is one of the ways of how taping works. Mechanical advantage, dynamic tape, when you put it to a structure with a stretch, it helps to pull back on that joint. And this gives a mechanical advantage. We'll see an example. Joint stability, rigid taping for ankle sprains, etc. Kinesio tape lifts the skin and helps with circulation and lymphatic drainage. And these in green are the good effects. The red effects are the not so good that we should also focus on. This article has done a short term, the next article, which I'm going to share, has done an effect of a tape, very short term, medium term, and long term. And they found out that kinesio tape has only short term effects. Whatever these green things, it's only short term. And the reason being, the adhesive goes off in some time. It can be 1 day, 2 day, max 3 day. However, rigid tape has medium term effects because it can last for around 5 to 6 days. They can cause skin irritation. They require correct application for many of the tapes, especially rigid tape and dynamic tape, and it does not improve performance. So, what I would want to tell you all, why are we using tapes? That is the first question we got to ask ourselves. Second, what is the context of using tapes? If you understand these physiologies and use it, it will be much helpful, not just for the sake of using it. And the third and most important, which was in the conclusion of all the researches that I read, taping is an adjunct. What is an adjunct? You can see this big toolbox in the photo. You have many tools in physiotherapy, but taping is not the main treatment. It's an adjunct to exercise, to this, to that. Okay, so please make sure it's not the main treatment. And if it is a placebo, so what? Use it for your benefit. If it's helping a patient with pain, at least short term, they can do exercise in that short term and improve their condition. So use the placebo to your effect. Contraindications, I've just included the main contraindications. Open wounds and infections, common sense, we won't put it on an open wound. Severe skin allergies. How to understand this? Ask a patient, have they put a bandage, a small, that bandage you put, 5 rupee one or 10 rupee one, and ask them, do they get a reaction to that? If they say, yes, my skin becomes red and itchy and all, you're not going to tape them, right? And they themselves say, I have a very hyperallergic skin. That's why consent and education is important. Deep vein thrombosis, and finally cancer. Don't put it on the tumor area. So it's usually, if they tell you they have cancer, it's better to avoid it. But if it's a far area, then you can put it. What are the principles? First of all, consent. Like I said, many people are very scared, and if their condition worsens, they'll blame you. So consent is important. Taping is very important. Education is very important, because if you put a tape for a person and don't tell them when to remove it, they'll come next week back to you, and when you remove it, you will find this color, this photo over here, red. I'm sure many of the physios over here might have experienced this, and I have experienced it too. So tell them how to remove it, what to expect, itchiness, then you need to remove it earlier. Then the technique to remove it. You never pull off the tape and wax your hair. You touch and hold the skin and gently pull the skin off the tape. Very important. And you can use tape removal sprays, adhesive sprays. When you're on field and you have 5 minutes to put to to treat the athlete, this is where taping comes in on field. They are sweating, you might not be able to dry them up completely, and in that state of excitement and tension, it's very useful to use an adhesive spray and then tape the person very well. So positioning, if the athlete is coming to you, you need to have a good position so that you can put the tape without wrinkles, because if there are wrinkles, it's going to cause a problem in the effectiveness of the taping, and also the swelling and all. It's going to create a mess. So you need to have the taping done wrinkle free. For that, a good position of both is needed. So for that, you need to practice, definitely. Application of the tape. It's very important when you put tapes not to stretch on the anchors. So when I'm putting a tape, for example, also an important thing is I should cut the edges off. A square edge is likely to peel off. So very important to cut it off. You apply the anchor, you give a good stretch, and then the other side also, you need to apply the anchor with zero stretch. Okay, this is especially for kinesio and dynamic tapes, especially dynamic tapes, because if you apply the anchor with a lot of stretch, there's going to be a stretch injury on the skin. So how to apply the tapes is very important. Observe when you put a tape, say on the wrist. Now, suppose I've put this tape for someone very tightly and they feel numbness in their hands or the color is changing of their hands. That means you have restricted the neurovascular bundle. The pressure is too much. So you need to observe the taping and educate them. If something like this happens, please loosen the tape. And yeah, removal of tape I've mentioned. You should use a sharer. This is the scissor used, and it has one end to kind of pull off the tape, because sometimes when you've done a lot of rigid taping, it's very difficult to peel it off. So you have to cut it off by scooping it up. These avoid injuries by, you can't poke the athlete easily with this tape, and it's really good and sharp. I've included 4 evidence-based taping techniques. This is my last 4 slides. So let's see. McConnell taping is having high evidence. Did I put the article? The article. Okay, I think I forgot to mention the article. I'll just read out the name of the article, which you all can see. The name is The Effects of Rigid and Elastic Adhesive Tape on Pain in Musculoskeletal and Sports Condition, a systematic review with meta-analysis of randomized control trials. This is in JAWS PT Open, which is a very highly valued journal for sports physiotherapists, and it is into August 25. So please view that article. Okay, you all can see my screen. Once again, I'm back. Yeah.
Yes, yes, we can see your screen.
So we'll see the McConnell taping. It's in fast mode. So I'll just quickly explain. There is one mistake in this, and I hope someone can identify what mistake is there in this video. I have put underwrap for the patient around the knee. I'm taking the rigid tape, placing it at the lateral end of the knee joint. And after I place it with my thumb, I'm giving a medial glide to the patella, and I place the tape. You should see creases like this on the medial end. That means you've done it well. And I put another tape to reinforce it. And I put anchors on both sides. Okay. So like you all can see, it's done by rigid tape. The indications are not only patellofemoral pain syndrome, but also arthritic changes in the knee. And I have got good results with this tape, not only in sports, but in my clinic center. Someone speaking. So the mistake was the position has to be in complete knee extension. And how does it work? It corrects altered patella kinematic. So you need to observe how is the patella? Is it medially, laterally tilted, shifted? So what happens in many patients? It is laterally shifted due to tight lateral structures, and the patella tracking on the trochlear groove is affected, which causes a bit of friction and causing patellofemoral pain. This is one of the ways. So when we medially tilt it, it helps proper tracking. Okay, it can be a shift. Oh, I heard my voice.
Guys,
Okay.
just to mention, sorry, Dr. Kryson, we'll take your questions at the end, guys. We'll give some 5 minutes at the end for your question. Just one person wanted to know that do we round up the edges for this rigid tapes, Dr. Kryson?
Rigid tape, no. The reason being we are putting anchors on, right?
Hmm.
So rigid taping, we don't need to round up.
Round the edges. Okay, no problem.
So kinesio tape, I use this kind of uh, round technique, like an eye technique, what I say for the shoulder and the knee. It's really helpful, and it works on a very basic pain modulation, like we learned in the previous slide. It can be used for general pain, knee pain, patellofemoral pain, osteoarthritic pain, pain from ligament strains. It is not going to help in stability, but it will just help in pain short term. So you may use it during the match or during the exercise. Okay. So I put the positions, knee flexion 30 degrees. And for shoulder, it is just a neutral shoulder adduction. You can play around with these tapes. Like for example, in the first one, I've pulled the tape a little with the shoulder retraction behind, so that I am covering and trying to get the shoulder into slight retraction. So when the patient goes into a protraction, they will feel the stretch, and that's the proprioception uh, physiological change that we see. That's how it works. So then again, they can be reminded to go back. Next, we see ankle stability. This is something that is really used, which has the highest evidence, and I have used this a lot in athletes in cricket and kabaddi. So first we use under wrap around the ankle. Ankle inversion sprains are very common, where the ATFL, the anterior talofibular ligament, uh, is torn or injured, or there's just some laxity, chronic ankle laxity. So when do we do this? Immediately after an injury, we can do this taping for the athlete to prevent further damage on field, that is if they are injured and if they have to be shifted out, or if they have a partial injury or a grade 1 injury and they have to play the match, like the coach says you have to send this player, you can't make him sit down. So to prevent further injury, you can use this ankle stability taping. So when you do a good wrap, you try to you start this tape. So very basic, okay? You start this tape from the medial ankle, that is the medial malleolus. You pull it underneath the calcaneum, and what I do here is I pull this tape so there is slight eversion, and I attach this tape. So what is this doing? I want you all to get the concept. Now if the athlete tries to invert, the range is restricted. So that's how the rigid tape works. It's restricting range, and there's high evidence for this kind of taping. And you put a few anchors. So very basic taping. You require to practice this. There's also heel lock and many other taping techniques, but in Vana, it's impossible for anyone to teach that to online. So this is to help you to get an idea. of the taping technique. Can be done in long sitting or lying, and you can do it for medial ankle as well. Another thing I forgot to tell you also, these two taping techniques, the shoulder, I used it as pre-taping techniques, pre-match taping techniques for athletes. So suppose an athlete had on and off knee pain and he's going for a kabaddi match or cricket match, he says, just do some taping. So this is something that I do with Kinesio tape, just to keep him in mentally confident. uh, it really helps. If I know athlete really needs restriction, I will use a rigid tape or a dynamic tape. So how do dynamic tapes work? They assist movement. So suppose a patient has a distal biceps tendinopathy and elbow flexion is affected. I put the anchors with no stretch. I give put the tape with a very slight stretch, with the elbow in a flex position, or no stretch in a flex position. So when the athlete extends the elbow, there's a restriction to end range elbow extension and assistance to elbow flexion. So if you understand this principle, you can use it for anything. For example, shoulder, a scapula, what do you say, supraspinatus tendinitis. The shoulder is feeling difficult to abduct. So you put the tape, the dynamic tape, from the neck, from the supraspinatus origin, from the supraspinous fossa, right to somewhere at the mid arm in this position. And when the athlete takes the hand down and trying to abduct it, the stretch of the dynamic tape will assist that movement. So you can use it for ankle as well. So an Achilles tendinopathy, you start the tape from the calf, and the ankle is in the shortened position. So by shortened plantar flexion, and you all these tapes you need to rub and let the heat activate it for the adhesive to work. And you can see this movement. This is supporting the Achilles tendon and helping in plantar flexion, which is painful in Achilles tendinopathy for this patient. So just to make you understand how dynamic tape works. And cohesive taping, my favorite. Mild support, there's not much of restriction, but it gives a lot of mental support. It can be used in return to play. So athletes love to wrap their wrist, figure of eight of the ankle. It sticks to itself, so lesser skin complications. These are the 4 taping techniques. Yes. Now we'll come to the questions. So hope this was enlightening for you all and will help you all in your journey of sports physiotherapy. Please shoot any questions that you have. Dr. Parijan, you there?
Absolutely, absolutely. Well, thank you so much, Dr. Kryson, for that enlightening lecture on sports injury prevention and sports tipping. And I understand, guys, that was just a short glimpse within an hour online. And just let you guys know that Dr. Kryson would be doing an in-person 2 days hands-on training in Mumbai in the coming month of November on 29th, 30th on all details of sports taping, different applications, and different sports injury prevention techniques, and all these testing and some kind of a treatment prevention as well, with some of the exercises as well, because exercise prescription becomes an important role. And in our ISOM courses as well, we say that most of the knee patients coming to us for the knee for the athletes, they can be because of the hamstring dominance. So you need to know how to check the hamstring dominance. That's why their meniscus get damaged, ACL can have injuries. All right. So we can take some of the questions, guys. Understand this was not a taping course. This was a free live lecture. And yes, we will be sharing the quiz link. There's a small quiz. If you pass that quiz with a score of 7 out of 10 in your first attempt, you will get the certificate for this lecture. And let's take your questions. Before taking questions, let me just make some quick announcement, if you don't mind. We have our upcoming course on thoracic spine and the rib cage, because many people do a lot of soft tissues on thoracic spine. Yes, it helps, but it will also help if you start assessing the thoracic spine and rib angles, particularly that me and Dr. Cody Hanish, who is a chiropractor from Australia, we would be doing that next weekend on 25th, 26th. And one last one. I will be coming in November to different cities in Delhi, Chennai, and Mumbai to do in person hands on training for pelvis and sacroiliac that Dr. Kryson mentioned, which is very important, lumbar spine, as well as hip, knee, and ankle with some of the muscle energy techniques. So if you really want to learn the assessment and the management along with some muscle energy techniques, manipulation, soft tissue for pelvis, sacrum, lumbar spine, hip, knee, and ankle, you're welcome to attend our in-person hands-on training in the month of November in Delhi, Mumbai, and Chennai. All right. Thank you so much. And let's take your questions now. Let me take it from the top. Somebody asked about the sports injury. Any idea, Dr. Kryson, about how much minimum percentage of rest is required in pre-season and in season? What about the rest thing? How much rest is required for an athlete in preseason and in season? I know that question seems a little incomplete. If that is after injury, uh, if you're asking, I don't know. So yeah. Oh, sorry. You are. Very sorry. Just give me a second. Just give me a second. How do I unmute you? Sorry, I'm not very technical friendly. Sorry. Oh wait. Give me a second. No. How do you mute? Great. Yeah, there we go. Sorry. Sorry. I'm extremely sorry. Not very.
So, in the entire 2 days workshop, I'm going to be including so many things. How to actually check whether the sleep is enough. There are with the heartbeat monitoring, the athlete sleeps and wakes up. There's a technique to make them. So the technique is you make them first lie down on the floor. You check their heart rate, and then you make them do a very high intensity exercise, and you check what is their heart rate next and how long it takes to come back to the resting heart rate. The time of that will give you an idea of their whether their sleep was whether their recovery was in a good or bad state. So with big elite teams, they have these watches, and you just make them do this exercise, and it gives a red, orange, or green on an app, which kind of tells you. So it's different for everyone, but 8 to 10 hours is a good level.
Absolutely. Thank you. Somebody's asking, can we use kinesio tape instead of dynamic tape for the same functions?
No, it's a context, but kinesio tape does not have the recoil property. Kinesio tape works more on tactile pain modulation, lymphatic drainage, and for swelling. So it does not work as a dynamic tape. Dynamic tape is much stronger. So, but the only thing is it's more expensive and not available. But dynamic tape is a different use. There are different courses nowadays on dynamic tape certification, kinesio tape certification. So if you do this, you'll get a very in-depth idea about it.
Absolutely. Absolutely. Somebody's asking, how does bathing or are the tapes water friendly?
Nowadays, many of the tapes are water friendly. Uh, you can bathe with them. So kinesio and even dynamic tapes to some extent you can bathe with them, and they remain for around 3 to 5 days. It's better to try to avoid wetting it because there's a more chance it'll come out. But if you see athletes, right, when you tape them, they after the match they just remove it off. So that's the truth.
All right. Next question. How long do you think you can keep the tape for like a case like tennis elbow, the taping?
Kinesio tape three to 4 days, 3 days actually. Uh, yeah, I think that should be good. Dynamic tape can last 4 to 5 days, and so can rigid tape. But this also is important. Are they sweating? Are they getting itching? How is the quality of the tape that you've put? If everything,
Absolutely, absolutely. Thank you. One last question, and it's a very generalized question. Does taping athletes' knee or ankle affect their movement efficiency or overall performance?
Yes, it does. And this is one of the MCQ question too. So if you are going to tape a footballer with a with say a really a ankle tape, a heel lock tape, do you think they're going to be able to run well and shoot and do the zigzag movements? No, it's going to restrict them. So that's where you use your critical analysis and maybe use a dynamic tape or a kinesio tape on field. So you have to think what is the extent of injury and what do you want? How much movement do you want? So if you don't want movement, you'll do a double heel lock. If you want some amount of movement, you'll do a single heel lock. So that's how it is definitely going to affect their performance.
Absolutely. One person asked a question, and let me tell you, Dr. Kryson has done a post ACL lecture with us as well, and it is there on our website. You can access a lot of courses done by Dr. Kryson and other sports courses on our website, guys, on our website www.isom.org. So this question is referred towards the post ACL reconstruction phase, where the patient is coming in the plyometric phase but has some lateral knee pain. So in that case, how do you go for the plyometric assessment, or what kind of assessment do you do in the plyometric phase? That was his question.
So on the plyometric phase, a lateral knee pain. Uh, so if it is a surgical case, um, you have to check, has the athlete overdone his rehab, or have we accelerated too fast with the exercises? For example, if plyometric need to be started say 4 months and you've started it at 3 months, or is there a minuscule component? There are so many variabilities, but the best thing to do assessment wise is to check the inflammation and the symptoms, give him a bit of rest, go down on the exercises, do other variations, and then slowly get back to plyometrics. Assessment ways, I think the normal assessment that we do, we check for swelling, we check for palpation, we check instability, we check the history. Have they done some extra walking, or I mean extra running, played a match when they're not supposed to? This triple hop test will definitely come positive if there is lateral knee pain. You check for McMurray's test. You check for lateral collateral ligament stability test. You check for the IT band snapping syndrome, hip snapping syndrome. Sorry, the IT band test, and all these things. You will get a better idea.
Sure, sure. And as I keep on stressing on the pelvis, don't forget this pelvis, guys. Pelvis is very, very important. Our healthcare professionals are lacking in some of the information of the pelvis. And I ask simple question: look at the size of the pelvis, the innominates. It's quite big, and we keep on focusing on lumbar spine. So focus on pelvis too, because most of the trunk muscles and the lower extremity muscles are attaching from and to the pelvis. So please make sure your pelvis and sacrum knowledge is crystal clear. All right, so let's wrap it up for today. Dr. Kryson, everybody, thank you so much for attending. The quiz link has been shared in the chat box as well as in the WhatsApp group. Dr. Kryson will be doing sports injury and sports taping course in person, hands on training on November 29th and 30th in the city, Mumbai, financial capital. So if you really want to learn from Dr. Kryson in person, you're welcome to learn this in person in a 2 day hands on training, which is coming in November 29th, 30th in Mumbai city. Yes, sir.
So I want to tell you all that this course is going to be a lot of practical. It's not going to be just theory. It's going to be really fun because we are going to do all these tests in person. So be it a agility hexagon test, be it a sprint test, be it a stability test, a YBT, FMS, a musculoskeletal screening, you are going to do it on your own with your partners or with the other physios. So it's going to be out. It's going to be maybe in the grass or whatever permission Dr. Parijat gets. It's going to be really fun. So I invite all of you all to join because as physios, we undertreat our patients. I see so many patients just doing basic stuff, going on field and getting another re-injury. So as physios, be it musculoskeletal or sports, all of us should have basic knowledge of this. So I invite all of you all to come and upgrade your skills, that you become quality physios, that we can build up the name of physiotherapy in India.
Absolutely, absolutely. So we have to build up the standards, guys. So this was just a glimpse of it, maybe 10%. And the rest of the picture will be shown by Dr. Kryson in the in-person hands-on training that is going to happen soon in November. So come and you can follow iSound on social media, Instagram, Facebook, LinkedIn, etc., to know the updates about different in-person trainings as well as hands-on trainings. All right. Thank you so much, Dr. Kryson, for your valuable time and your hard work in the presentation. We hope to see you soon in the frequent lectures and in the in-person hands-on training. Thank you so much, guys. Enjoy, keep learning, enjoy your Diwali. Happy Diwali to everybody from India, and stay blessed, keep healthy. Good night. Thank you so much, Dr. Kryson.